Okay, and so you came in with some vein concerns and some other health goals. Tell me what brought you in. Tell me what's going on with the veins.
I think a lot of the initial reason why I came in was like digestion, sleep issues, and things like that. And the vein thing was a concern because the doctor that I went to was telling me that it could be like a bigger problem down the line, and that it was like really, he made it sound so scary. And so, when I initially came in, like I had just a bunch of stuff going on that I've been dealing with for years that I haven't really been able to, find a solution to with like diet or exercise or anything really.
And you're a fairly healthy, super active person.
Active.
And
Yes.
You couldn't get ahead of this stuff. And the vein thing, they called it vein reflux. Is that right? And so essentially the vein was widened, and so the little mechanisms, the valves in place that keep the blood moving forward and keep it moving back towards the heart from the extremities isn't able to do their little pumping job because it's too blown out in there. And you had gotten a procedure done or some testing done. What was that?
Yeah, so I went in for like injections for a few little spider veins in my legs, and they had to do an ultrasound before they do the procedure just to make sure nothing else is going on. And they found this thing they called vein reflux, where they do the ultrasound and they measure how long the blood drops before it starts going back up. And they were saying mine was like 4.5 seconds, which is not good.
What's it supposed to be?
Like less than a second.
Oh, wow.
So I hadn't really heard of that before, and I don't totally know all the details about it, but they said that eventually I would probably need to have like a procedure with like a catheter put into my veins and all kinds of crazy stuff, like a pretty invasive procedure.
And your veins, I mean, it's pretty full body, super visible, super blue. And is there any like pain associated with that, or is it more the aesthetics that was getting your attention?
The aesthetics, but also I would have like restless legs at night, but I would also just feel like my legs were always so heavy. Like I run a lot, so I'm like, well, it's probably just that. But even with recovery and even with like, diet and all that stuff, like I always just felt tired. My legs always felt super heavy. Just nothing would help.
Yeah. And so we've done your initial consult, and then this was your third session of the series. And what results have you seen so far with all of the gut and the sleep?
Yeah. I think the digestion thing is the biggest thing I've noticed, because before, like, pretty much anything I would eat would bother me, and now it's, like, very minimal if it does happen, but it's pretty rare now, even after just a couple sessions. I'm sleeping better, like, I'm tired at night, and I actually can fall asleep. And then I just think, like, I felt, like, lighter and, overall just functioning better, I guess. Yeah.
And your last couple of sessions were pretty big in removing the fluid and the pressure in your legs specifically. But have you noticed any changes so far in your workouts, or anything feeling easier, longer, more reps, anything like that you're noticing yet?
Yeah. Well, I actually, like, my workout this morning, even though I was really tired and I wasn't super motivated to do it, once I started, I felt like really just like I could go forever.
Yay.
And my runs have been really good. Just like I've been able to hold a faster pace overall and not be as tired. And my legs haven't felt as heavy. That's the one thing I have noticed big
That's
time.
Awesome.
Yeah.
Oh, I'm so excited for you. And then we just looked at your before and after pictures from some of your veins in your armpit area and then on the hip, and from before and after just your last session and then after today is massive. So we're kind of thinking that, by depressurizing inside of the vein and around the vein, that vein might be able to restore its size and function and actually potentially reverse or heal the reflux issue.
Yeah.
Are you feeling like that potentially is a thing that could be going on?
Yeah. I think I'm like shocked and super surprised by the results. I mean, obviously, seeing a before and after is really helpful because, you know, when you see changes, like when people lose weight, it's gradual, you know, and if people don't see someone for a long time, that's when it's noticeable. But in like 2 hours, there's like a huge difference. And so I think there's definitely going to be a way to resolve that issue for sure.
Oh, I'm so excited for you. I can't wait to see what happens in the rest of your sessions.
Yeah, me too.
Oh, thank you so much.
Of course.